sure each one of you agree that this is a beautiful evening with so much of knowledge, information coming in. And now we have somebody very, very special lined up. And I take pride in introducing Dr. Yumnam Nelson. He is CMO with NFSG. And the topic is again very, very interesting. He is going to help us in this short period about COVID-19 prevention and home care. Thanks a lot, Doctor, for coming over and helping us to understand how to take it forward. He is a professional doctor working in Department of Anesthesia in Indira Gandhi ESI Hospital, Delhi, under the Minister of Labor and Employment Government of India. That's so nice. He has professional experience of more than 25 years, Silver Jubilee. Congratulations, sir. That's so nice. He has special interest in ultrasound guided nerve blocks. My goodness, I need to touch base with you. I haven't heard about it in the past. Hospital disaster management and basic life support training. He loves reading motivational and self-help books, and he also is a public speaker and power writing enthusiast and budding YouTuber. So we can expect his YouTube channel once he's done with that. And without any further ado, I would like to hand over to Dr. Yumnam Nelson and help us with how can we prevent COVID-19 and have some home cares. Thank you, sir. Over to you.
Thank you, Sureshji, and thanks a lot to World Transformation Organization for giving me this opportunity to preach something about COVID prevention and home care. So whenever this COVID-19 comes in our mind, what does it strike us? It strikes us with this lockdown, the world being shut down. Why is it so? It is to prevent the spread of COVID virus. So lockdown is the final measure. So what if we prevent from the beginning that we don't have to go up to lockdown? That is what I will start with today. So please join me. I'll share my screen. So it is a very important topic that if we all understand how we can manage to prevent the spread of COVID virus. So today, the COVID virus is prevalent all over the world. So we need to know how it is being spread from one country to the other. So the first and foremost to prevent a spread is to understand how it is spread. We all know that it is a virus, a very simple virus, a very weak virus. But how does it spread? It spreads, first of all, as an airborne spread with droplet infection. Viruses from the nasal cavity of a sick person, it is blown out in the air, and it's there in the air, and it goes into a normal person's airway and mouth, and then he gets the disease. The second mode of transport is by direct contact. When you come in direct contact with the patient, you touch him, you shake hands, and the virus, it transfers onto you. And another mode is the fomites. Fomites are nothing but inanimate objects like the towel, the keyboard, mouse, door handles. These are the fomites on which the virus lands from a sick person. And when we touch those with our hands, and when our hands, which are laden with the virus, touch our nose, mouth, eyes, we get the infection. So these are the three basic steps which if we understand, we'll be able to help reduce the spread of COVID. So if you are in close contact within 6 feet of a patient, you are more likely to contract the disease. And if you are more than 15 minutes outside without a mask, where there may be the virus prevalent, then you are likely to have it. And it is said that the virus is shed 2 days before the symptoms in the patients and 2 days before the specimen is positive from the collection date. So we have to think of 2 days before, when we had that symptom, that the virus is being shed. And if you are in a closed space without a mask, if you are there for 5 minutes, you are more likely to have the disease. So with this basic knowledge, how do we prevent the spread? So in this picture, you will see the location. The further away from you are in an open space than a closed space, you are less likely to have the disease. And if you are in a spread out with others from others and not in a crowd, you are less likely to have the disease. Then if you are exposed less for a lesser time, then you are less likely to have a disease. So be in an open space and at a safer distance and for a shorter period, you are less likely to have the disease. And apart from these, wearing a mask properly is very, very important. You can see in this picture the percentage of risk when it is the highest, 90%, when both the sick and the healthy don't wear the mask. And you can see if the healthy person is only wearing the mask and the patient is not wearing, the risk is 70%. But as soon as the sick person wears the mask, the risk is only 5%. But when both are wearing the mask, it's only 1.5%. So this is very important to understand, that wearing a mask properly, closing the nose and mouth, is very much important. So how do we stop the spread of COVID virus? So there are basically, risk is equal to the threat times the vulnerability. Of course, the threat is always there. The COVID virus is prevalent all over. But we can do a lot about the vulnerability. So what are the vulnerability? If you are not wearing a mask, a proper mask, a tight-fitting mask, or an N95 or a surgical mask, if you are not wearing those properly, then you are vulnerable. Next, if you are not cleaning your hands properly with soap or with sanitizer, then you are vulnerable. You can have COVID. Then, if you're not maintaining a safe distance of at least 2 meters, then you are not safe. You are likely to have COVID. These are the 3 pillars. And there's another pillar, which is get yourself vaccinated. Vaccines are there to prevent disease from long time back, but vaccines have come up for COVID also. So it is to be, we have to get ourselves vaccinated. So this is how we have to stop the spread of COVID. That is the prevention part. Now, if we are unlucky and we got the COVID virus, we should not be afraid or anxious, because most of the patients, they have a mild or asymptomatic disease. More than 80-90% of the patients, they don't have symptoms, or they have only mild symptoms. So in those cases, they can be managed at home. But there are some rules, some things which you need to know. If you know those, follow those, it's very safe. You should not be anxious. So first of all, who are eligible for home isolation? Patients who are having mild symptoms and patients who are asymptomatic. Mild means those who are having cough and fever, but they are not having the oxygen saturation falling less than 94%, or they are not having any respiratory distress. Asymptomatic means those who are tested positive, but they are not having any symptoms at all. So these are the patients which can be isolated at home. So what is required at home? What is required is for the patient to have a separate room or a separate corner for staying, and the contacts can stay separate from the patient. A caregiver is to be there 24/7 because the patient may aggravate anytime. So a caregiver, healthy caregiver needs to be there. And most important, there should be a good communication link with the caregiver and the healthcare provider, the doctor, the hospital. So these are the requirements. And those who are elderly, comorbid, and immunocompromised like cancer patients, HIV patients, they are not recommended to be managed at home until and unless they are cleared by the physician. Moreover, the caregiver and contacts should follow precautions and prophylaxis while managing the patient at home. So I'll come to that later on. So for the patients, what is required? He needs to be isolated in an identified room, separate room, a corner of the room, and it should be well ventilated. The windows should be open, the air should be flowing, and the patient should be wearing a triple layered mask at least, or an N95 mask. And if it is soiled or if it is used more than 88 hours, it needs to be disposed of. And the solution to be used is 1% sodium hypochlorite. So these are the things which needs to be done. Then for the patient, he needs to be stress-free. He needs to take rest properly, and enough fluids is to be taken, and a good diet. Also, he has to follow respiratory etiquettes. While coughing, he has to cover his nose and mouth with a tissue, disposable tissue preferably. Next, he has to wash his hands frequently with soap, taking at least 20 to 40 seconds, or otherwise an alcohol-based sanitizer. And no sharing of items, no sharing of plates, utensils, glasses, hankies, towels. They should not be shared, the patients and those who are not sick. And the surfaces are to be cleaned frequently, and 1% sodium hypochlorite is used. And most important is to monitor the oxygen saturation of the patient, because there is a condition called happy hypoxia where the oxygen saturation falls, but the patient doesn't feel any symptoms at all. And the temperature is to be monitored, and the symptoms also is to be monitored. And if there is any aggravation, if the patient deteriorates in any of these, and then promptly it is to be reported to the healthcare worker, the doctor. So for monitoring, the symptoms are to be noted counting from the day of the start of the symptoms, and daily, every 4 hourly, it can be charted. The temperature, the heart rate, or the pulse from the oximeter, and the oxygen saturation. We need to have a pulse oximeter at home. If the person cannot afford to have a pulse oximeter, the government they provide the pulse oximeter from the government, and it is used to monitor the pulse oximeter. And whether it is feeling better or not, it is to be noted, and the breathing, the respiratory rate can be noted, or what the patient is feeling, it can be noted. Next, for the caregiver. So for the caregiver, he also needs to wear a mask, a triple layer mask or an N95 mask, and the mask is not to be touched from the outside, and it is to be changed if wet or dirty, or if it is more than 6 to 8 hours. And hand hygiene is very important. Washing hands frequently with soap and water, with taking at least 20 to 40 seconds, and or otherwise a hand sanitizer with alcohol base. So every time before cooking or after cooking, before eating or after eating, and before wearing gloves and after removing the gloves, and while using the toilet also, the hand hygiene is to be followed. The soap is to be used, and a dry disposable towel can be used, and or a dedicated towel for the caregiver. And what about the exposure to patient's environment? It is to be taken care of. Avoid direct contact with the body fluids and contaminated items. We have to throw the body fluids separately so that it does not contaminate the other areas of the room. The food is served into the room where the patient is staying, and the utensils are cleaned with using soap and detergent and using gloves. And what about the disposal of the biomedical waste? It is to be disposed following the guidelines of the country or the state, but whenever it is disposed, it should be marked as COVID waste, so that those who are picking up, they will understand what the content is. So for such patients, what are the management which can be done at home? So first of all, there should be always a clear communication link with the patient's caregiver, and the healthcare providers, the doctors. And if there is any comorbidity, the medication should be there. And if the patient is having any symptoms like fever, running nose, and cough, the symptomatic management is given. Cold sponging for fever, steam or paracetamol even, warm gargles, and steam inhalations. So paracetamol can be given if the fever is very high. Even inhalational steroids can be given if the symptoms persist for more than 5 days. Oral steroids are not to be administered. Self-medication should not be done. It's to be given only under the advice and supervision of the doctor, and after beyond 7 days of symptoms. Because if it is given early, the virus replicates very fast and the patient can deteriorate. So if the oxygen saturation falls down and the patient is breathless, then the hospitalization is required. So these are the things which are to be monitored very frequently. And if in spite of all these, you don't get a hospital, like in the recent spurt of the second wave, there was no hospital, no oxygen, then if you are at home and if the saturation is not dipping very much, then the patient can do what is called proning. So if in the pulse oximeter, if it is dropping below 94% oxygen saturation, and if you don't have access to an oxygen cylinder, what do you do? So in that case, the patient is made to lie down on his stomach with a pillow under his shoulder and another pillow below his hip. The abdomen is left free and another pillow below the shin. This helps the oxygen ventilation ratio properly. So the ventilation is improved by proning. This is kept for 30 minutes. The patient is lie down in 30 minutes. He can lie down more if he is able to. And after that, he can be made to lie down in the lateral position as shown in the picture. And after 30 minutes of this, he can be made to lie down slanted, propped up. So these are the positions in which the patient can rest so that the oxygenation improves to buy time. So finally, when do we seek medical attention? This is very, very important because at home, this mild and asymptomatic can be managed. But if he or she starts deteriorating, medical attention is very much needed at the appropriate time. So first of all, if there is any breathing of difficulty, medical attention is to be sought. If there is any dip in oxygen saturation, less than 94% on room air, although they can tolerate even less than that, even up to 88%, but still, if the oxygen saturation falls below 94%, they have to seek the attention of the doctors where what is required. Then, if there's any persistent pain pressure in the chest, next is if there's any mental confusion or inability to arouse, medical attention is to be sought. So with all these, I would like to request everybody that this pandemic is running havoc to all of us, but we have seen that by going into lockdown, all the preventions are put into place with the mask, the distancing, avoiding crowd, and it is kept under control. So my last advice to everybody is to follow the 3 principles: wearing mask, keeping physical distance, and proper hand washing frequently. And the 4th pillar is to get oneself vaccinated. So with this message, I would like to end my talk, and you can contact me if you have any queries in all these social media sites, and you can contact me as Dr. Yumnam Nelson. I'm there in all the social media sites. Thank you.
Thank you, doctor. It was fantastic. Do you have any videos you want to share?
Right now, I don't have. I'll have to search if I have some videos, physiotherapy and all about proning.
Probably you can share the links the way you mentioned, or once we reach out to the YouTube channel, I think we can see there, right?
Right.
Okay. So thanks a lot, Dr. Yumnam Nelson, for taking out time, and it is so appreciative. I know a few doctors, and all of you are working like, more than 12, 16, 18 hours off late. And in spite of that, your passion towards spreading the word gives you so much of energy. And I can see that charming face and helping us out at this point of time. Thanks a lot. And I think one amongst the things which was very, very interesting is we generally don't talk about the caregiver and home isolation and the doctor. How should be the dynamics? So it was pretty clearly told while you were talking about all the points in a very, very simple manner. And at the same time, mild and asymptomatic, how do we manage at home? And the concluding point was ultimate, when exactly we should seek, because everybody has got an oximeter, but really don't know when and how to do, and what should they do for 90 minutes or 60 minutes immediately as an home remedy. So thanks a lot, fantastic, and we appreciate. And now I would like to hand over to Kushal to take it forward.